Today's lecture is about benign and malignant tumor. What is a tumor? At the beginning, tumor is just a neoplasm or a new formation on the body, occurs because of consistent and frequent trauma to the tissue, causing it to proliferate and divide rapidly, more than normal, causing it to form either benign or malignant tumors. Starting with benign is small shaped, small size, normal shape ulcer or lesion, and occurs just frequently and can be dissolved by its own or stop growing, which is not harmful. Difference between it and malignant tumor that is rapidly developing and rapidly proliferating with irregular shape and proliferate to distal areas of the body through metastasis or through expansion. The nucleus of the benign is normal and its size compared to the cytoplasm cell is smaller, or the ratio is less than the ratio of the nucleus to cytoplasm size when it comes to malignant tumor. Malignant tumor can cause death if not treated and will not stop from its own. Also, malignant tumor has a gross anatomy of irregular shapes and non-capsulated, at the opposite of benign tumor that has a regular shape and present the normal tissue most of the time, do not invade or do not occupy tissues far of its original. And the benign tumor only causes a problem when it is exists at the brain, spinal cord, vital structures through pressure, while malignant tumor can't cause much more destruction. We talked about now the difference between benign and malignant tumor. Let's move on to take some examples of the benign tumor, including fibroma, which is a benign tumor that causes the body to form connective tissue, fibrous tissue rapidly within certain areas of the body, or for unknown reason could this benign tumor occur, or due to trauma or consistent trauma to the soft tissue. Fibroma can be disregarded or it can treat itself and dissolve with time, or if treated, a conservative surgical removal is required. Same goes for the benign tumor of lipoma, which is the most frequent benign tumor of soft tissue. Lipoma, just like fibroma, can dissolve from its own or stop growing. Normally less than 1 centimeter it is, and on the mouth it can be visualized easily, but when it comes to intermuscular lipoma, it is harder for the surgical performer to remove it completely. That's why it has a more frequent recurrent rate. And it is its shape or color is yellowish. Let's move on to the pyogenic granuloma. The last type of tumor today we'll be discussing is the pyogenic granuloma. Pyogenic, it has no pulse, neither it represents a granuloma, but it is called this way. Well, the right or correct naming would be focal fibrous hyperplasia. The correct name is the focal fibrous hyperplasia, and it is very frequent within adolescent and young people, while lipoma is more frequent with people more than 40 years of old. Pyogenic granuloma is vascular tissue growth that could be at the beginning of its formation very red in color and could bleed easily, while it will become, when it matures, it is less frequently bleeding, or less frequent bleeding will occur. More frequent on the anterior maxillary, and less frequent on the lingual mandibular side of the mouth. It could occur on different parts of the body like head and neck, and other parts of the body. So we talked today, we finished this lecture. It was an easy lecture. We talked about the causes of malignant tumor or malicious tumor that could cause necrosis, which is also a type of cancer. And we talked about the benign tumor, which is can be treated easily, normal shape, normal size, and less than 1 centimeter. And it does not go to other side of the body through cell, through regular circulation of blood and lymphatic circulation, not like the metastasis in malignant tumor that could diffuse throughout the body, performing different malignant tumors around the body. And we talked about different types of tumors, benign tumors.